knowledge on this topic. And it really has proved to us in years past when I teach this class, and Sarah teaches it online, that students really benefit from this opportunity and having her come in and listening to this information. And it helps to clarify a lot of points for students who are really wondering about opportunities career-wise in early intervention. And that we see year after year. So when she says, do you have any questions? Like, I'm not judging you if you don't, that's fine. But if you do, ask them. Really, now's the time. Okay? So thank you, Sarah, for coming again.
Thank you. Hi, everybody. If you don't know who I am the director at the lab school on campus. In my previous career, I used to do home visiting. So I always talk about this topic in the live class, and I never actually talk about it online other than just posting this PowerPoint, hence the videotaping portion of this. And I wanted to give you confidence that sometimes in this field you have to be videotaped, and it's not something to be nervous about. It happens to us more often than we probably like, but it's good practice. So when you think about having to stand up here and do presentations or teach a class, it's the same thing. You have to get this practice over time, and it's good for you. And it builds confidence with talking to families about things, talking to staff members, talking to people you work with. So just want you to see that we also have to do these uncomfortable things sometimes too. So I wanted to talk to you a little bit about family-centered early supports and services. That's what it's called in New Hampshire. What you may have heard before is early intervention, or EI. Has anyone heard that term? Okay, a couple people, a couple nods. A couple nods. So when you hear those terms, just know that it's all the same thing, but in New Hampshire we refer to it as FCESS or ESS or early supports and services. There's lots of different terms. We're talking about the same thing, okay? So does anybody know anything about early intervention or early supports and services? And you can just yell it out. It's not formal. You said you've heard of it before, so what have you heard about it?
They do evaluations.
They do evaluations. Perfect. We'll talk a little bit more about that. Yes?
It's for like really little young children, like babies and stuff.
Yes. So because I'm presenting this in your infant and toddler class, this is only specific to infants and toddlers. So birth to 3 years old. Great.
They do services.
They do services, yep. Anything else? Has anyone ever met anybody that does this job? Okay. And what did they do when you met them? Were they at your child care center that you work at?
No, she's one of our teachers here.
She's one of your teachers here. Okay. I don't know who that is. Yes, Kim. That's right. She's new this semester. That's right. Yeah, she's what is her job by trade?
She's an OT.
She's an OT. So when you think about OTs, speech pathologists, you might think about them in this capacity. They may have this role in this job. So let's this screen will tell you a bit more about it. Again, usually referred to as ESS. It's home-based or natural environment. Does anyone know what that term means, natural environment, when talking about infants and toddlers? No? Does it sound unfamiliar? That's okay. So the natural environment would be anywhere a family could be. It could be at a park. It could be in a child care center if that's a natural environment for that child. It could be in their backyard or in their driveway. So children and their families spend different time in different places, and it's different for each family. So home-based is generally what you think of when you think of home visiting, but it can be done in the community, in the child care center. And then they are for children birth to 3, like Katie said. And in order to be eligible, they have to meet certain criteria, which we will talk a little bit more about. And then there's a process for deciphering whether or not the child's eligible, which you mentioned, an evaluation. And then different disciplines work in ESS. And Shauna kind of alluded to this in her introduction. And I like to really talk about it when I do this presentation, because sometimes students come to me and say, I don't want to be an infant teacher, or I don't want to be a preschool teacher, but I'm in the early childhood classes. What do I do? That's okay. I didn't want to be an infant teacher or a preschool teacher either. I found a role still in early childhood, still with young children, not in a classroom. And that's okay. There are other jobs out there that don't include being a classroom teacher. So sometimes students start to think about that, and you're at a really good place in your educational career to make these decisions. So when I say different disciplines, I mean people who go and get different degrees like occupational therapy, like you mentioned, or speech pathology, or there's lots of jobs, nursing, social work, child development from a psychology perspective. So you can get a job in ESS working in one of those fields, having started as an early childhood student. Does that make sense? Okay. And then anything else you can think of now that I've given you more information about this? No? Okay. There'll be more. So there is a process. And I like to talk about the process because oftentimes students in this class, maybe not always in this live class, but in my online class or in the evening class, they are already working in the field with infants and toddlers. So they may have a child in their care that they're concerned about. And so does anybody here work with infants and toddlers as their job? Great. So have you ever had a child in your care that you kind of question their development? Yes, you're kind of nodding yes. It may or may not have happened. That's okay. It's not a necessary thing. But when that does happen, this is usually the process a child and the family will go through if you end up deciding to refer them to ESS. Yes, Katie?
When I was in 6th grade, I had to see an OT person because they noticed that when I go downstairs, I just use one leg.
Yep.
So like, okay, we gotta learn to use both.
And that's something that an OT would work on with a toddler in ESS, so that wasn't something that was affecting them in the 6th grade. So it's good to catch children early on with this. That's a great example, and it's something that they would definitely work on. Okay, so anybody can make a referral. That's really important because sometimes families get nervous about waiting for their doctor and their doctor having to make a referral and going through that process. That's not the process with ESS. They want families to be able to be referred and easily seen within a certain timeline. They actually have 45 days to be seen once a referral is made. So let's say a child at the CFDC I have a concern about, the teachers have a concern about, we would maybe talk to the family and then we could offer to make the referral for them, or we would give the family the number, or they could still talk to their doctor if they wanted to, but oftentimes the doctors just say, yes, absolutely, call and make the referral. And you don't have to have consent to make the referral. I just mentioned that because it is good to know, but eventually you will need consent from the family. So you could potentially have a child in your care, you've talked to the family, they don't want to do it, but maybe if you make that referral, the agency then can talk to the family and give them more information, and then the family will feel more willing to do it. That's not the best way to go about it, but it is a possibility. And so it's good to know that it's that accessible to families, that they don't have to have a doctor or somebody else to make this referral. They don't have to go to an outside agency to make the referral. They don't have to see a specialist. Once it's been made, they have 45 days to complete this whole process that I'm about to explain to you. Referral is step 1. Step 2 is the intake. So during an intake, a person who's considered an intake coordinator, that's their role. That's an associate's level degree job. So somebody from this program, early childhood background, could potentially go out and get this role. So I like to mention that as well. There are very few intake coordinators in the state of New Hampshire, maybe 12 or 15, but it's still a possibility. They go and they meet with the family. Sometimes the family comes to them at their office, sometimes they go to the home. And they do, an intake coordinator gets the family's background, their history, the child's birth weight. They ask all of these questions, and it's a routine kind of paperwork visit. So they don't have, it's really a lot of paperwork, and they're kind of that first person to meet with the family. And they give them information, and then they gather information as well. Any questions so far? Okay. Did somebody raise their hand? No? Okay. The next step is the evaluation. So whenever a child is referred, they get the intake, they get the evaluation. That always happens. So an evaluation is when at least 2 people from different disciplines, so remember I used that term before, a discipline means what your educational background is. So it could be an educator, like we would be considered, and an occupational therapist, or a speech pathologist and a physical therapist. So 2 different people with different backgrounds will go, and sometimes there's 3 people on the team, and they'll do an evaluation at the house of the child. And they use 2 different tools. One is called the HELP, it's the Hawaii Early Learning Profile, or the Infant Toddler Assessment and Developmental Assessment. And these are the two tools in New Hampshire that are used to do an evaluation. So if you worked as a home visitor or an early supports and services provider, you would learn how to use one of those tools. Each agency decides which tool they'll use, and they just use that one. Has anyone ever heard of either of those? The HELP or the IDA? It's not something that you would see in practice unless you were doing home visiting in New Hampshire, most likely. Child care centers don't usually use them. Doctors don't usually use them. It's really a developmental profile done by early supports and services providers. When they do these assessments, they check for 5 areas. So I'm going to quiz you here. How many of you have taken growth and development? Every single one of you. Yes. So in growth and development, you talk about growth and development of children. So what 5 areas, if you think back to that course, do you think that children are being assessed in? Say it aloud. Cognitive development, absolutely. Yes.
Emotional.
Social emotional development, yes. Physical development, yes. She took yours. Yes.
Literacy.
Not literacy, but something close to literacy. What could it be? Language development, that's 4. The 5th one's kind of hard. It's called adaptive or self-help. So those are the 5 areas. I've listed 6 because I broke fine and gross motor down. I could actually even break communication down to expressive and receptive language as well. But generally, the person who is doing fine motor will also do gross motor, so they're just doing the motor. And then the people who are on the team split those. So let's say I was going out to do an evaluation and I had my choice of which areas to do as a special educator. I would choose cognitive development, communication, language development, and social emotional development. Those would be the 3 areas I feel most comfortable with my background in early childhood. And then I was there with a physical therapist, let's say, and they would do adaptive self-help, fine motor, gross motor. Which one am I missing? How am I missing? Oh, there's only 5. That's right. Sorry. Yeah, so they do break down fine and gross, but generally that person does those. And I didn't bring the tests with me, but if any of you are in the early childhood with disabilities degree, we look at these more closely during our practicum experience. Okay, so now the child's been evaluated. Now they're deemed eligible or not eligible. So again, this is specific to New Hampshire. Every single state in the United States has early intervention. It's federally funded. It's something that every state offers. But in New Hampshire, this is our process. It looks different depending on where you live. In New Hampshire, there are 4 ways a child can be found eligible, and these are them. An established condition. So what do you think that could be? What do you think that means? No guesses?
Like a learning disability.
A learning disability that's been diagnosed. So remember, we're talking about infants and toddlers. So what's a learning disability or a disability that you think an infant or a toddler could possibly be diagnosed with? Yes?
Maybe they have trouble working on their fine motor skills, like picking small things or big things up.
That does count, but we're going to talk about that one later. This is a diagnosis that probably a doctor has given a child. Yes?
Like Down syndrome?
Down syndrome, yes. So Down syndrome would be considered an established condition because the child at birth was diagnosed with it, and we know, and doctors know, so we know as educators and doctors know, that there are learning challenges that come along with a diagnosis of Down syndrome. So automatically, children who are diagnosed with Down syndrome would receive services in early supports and services. Does that make sense? There's a whole list. Things that we've never even heard of, things that you'd be surprised about. Hypothyroidism, so if anybody has thyroid problems, hypothyroidism is something that is actually considered an established condition because there are known learning challenges with that or developmental concerns. Sometimes heart defects that also have other things that are with them. Autism would be one. So if a child gets a diagnosis of autism, they automatically are eligible. So that's what an established condition means. We still go through the process. They're still referred, they still are evaluated, but they're already in because of this established condition. The next one, and more common is kind of what you were describing. And this is considered a developmental delay. It's usually what happens when you have a child in your care, maybe as a toddler teacher, and you're thinking something's not quite right. It's not quite right the way his body's moving in space. It's not quite right the way he's using language or not using language. And so there's red flags, something we would call red flags. And then they would come out, evaluate, and decide whether or not the child has a developmental delay. So maybe they have a speech delay, or a fine motor delay, like you mentioned, or a gross motor delay. So if a child has a delay in one of those 5 areas that we've already highlighted, they are also eligible for early supports and services. The thing that complicates this a little bit is it has to be a 33% delay. So every home visitor has a chart that tells them what that means. So if the child's 9 months old, that means that they're 6 months old, 6 point something, to be eligible for early supports and services. So the child just can't be delayed. They have to be delayed by 33%. Does that make sense? And we have a mathematical way to figure that out. And it's a very common way for children to get services in ESS. They could still have an established condition that's not yet figured out. We're talking about infants and toddlers, so this could be a child that maybe at birth didn't present with any sort of condition, but now that he's starting to grow and his brain is starting to develop, we're noticing something's not right. So they may end up with a diagnosis later on of some sort of condition, but they've gotten into early supports and services through a developmental delay. Does that make sense? Okay. And then there are 2 other categories that are a lot less likely, but possible. So I'm going to show you. That's why I was getting this camera up. One of them is called atypical behaviors. So sometimes the evaluators will come out, they'll evaluate this child, and they won't have the 33% delay. But the parents or the teachers or both will be reporting that the child does things that are a little bit more extreme or aren't as typical as other children. And so this would be where they could get into early supports and services under atypical behaviors. So they're extremely fearful and in distress a lot. They have self-injurious behavior. So maybe they bang their head a lot and you can't get them to stop, or they scratch themselves, something that would injure themselves that you have a lot of trouble helping to get them to stop doing. Extreme apathy, so they're not showing a lot of affect, they're not showing a lot of energy for things, or even from a social emotional perspective, not really responding to situations appropriately. And also sometimes with infants, unusual or persistent patterns of crying, or with toddlers, sometimes we would call it a tantrum, but it goes on so long that the parent just really can't help the child. So it's pretty rare. I can count on one hand how many children I found eligible under this category, but it's a good way if for some reason that evaluation tool doesn't really find the things that we are seeing every day as we care for these children. The next one, that's why I brought this book, and I'll show it to you at the end, is the at-risk category. Also a little bit more rare, especially in New Hampshire, but it's a good category to have. So in order for the child to be deemed eligible with at risk, they have to meet 5 of these. So let's say the child was born weighing less than 4 pounds, so a premature infant most likely. The parents are experiencing homelessness. That would be 2 things right there. The parent has a psychiatric disorder. There would be a 3rd factor. So we're talking about factors that would affect whether or not this baby has the ability to develop appropriately and properly. Maybe the baby was exposed to drug usage or alcohol during the pregnancy, prenatally, and the baby has nutritional problems and maybe a failure to thrive situation, which is a term meaning the baby's not gaining weight even with food being given to them. So that they would have to meet 5 of those, which is pretty rare, and usually if a child is meeting those 5, we're already seeing signs of developmental delays in one of those other categories. But again, it's another way to help families get into this program and help these infants. Questions about that? Okay. I'm going to go back to this. It's going to take a minute. There we go. All right, so a child has been evaluated. They have been they've been decided that they're eligible for services. The next step is the IFSP. And now since I've left the field, these used to be different visits. We'd go and we'd do the intake, we'd go and do the eval, we'd go back and write the IFSP. Now they've streamlined this process. So a child is evaluated and the IFSP is written in that same visit. It all takes about 2 hours. So this is a whirlwind for families. If you can kind of put your head into a mom's or a dad's mind right now, they're finding out that their child is now eligible for these services. They're going through this whole process in a 2-hour period. So it can be a little daunting, to say the least. So the child's now eligible. We're going to write an IFSP. Has anyone heard of an IFSP? Has anyone heard of an IEP? Okay. So an IFSP is pretty much the same working document as an IEP, except for children under 3. That's really the main difference about the language. So IFSP means birth to 3. IEP means 3 years old all the way to 21 in the state of New Hampshire. It's basically special education services, but we don't call it special education services for infants and toddlers because it's really about development at that point. So they're going to write this. An IFSP is really it's paperwork agreement. It's an agreement about what they did, what that process was, and then what the next steps are going to be. So some of the important things that you may see on an IFSP, they're going to look different. Even if you went from one agency in New Hampshire to another, the IFSP paperwork might look different. They're trying to streamline it, but it doesn't necessarily mean they're all there yet. Present level of performance. So that means after they evaluated the child, they write down exactly what he's doing in each of those 5 areas we talked about. And then the most important thing is the signature. This is not a working document without a parent signing and agreeing to it. So you have to be able to come to an agreement about what makes sense. Usually at this stage, families have no prior knowledge about the special education process. If this is, let's say it's their first child, the child is 1 year old, the family may have never ever encountered this before in their life. So they don't know what they don't know. So it's really important that you kind of present this in a very positive way and that it's going to help the child and that you're working with them to do that. Make sense? Okay. And then the goals, the overall goals of early supports and services. So you really want to really empower the family, help them to work on their child's own growth and development. So you're kind of a specialist coming into their home or meeting them in that, whatever that natural environment is, but you're empowering them to carry out the things that you're showing them and teaching them. So it may look different than you expected. It's not clinical. It's really meeting that child and that family where they're at. So let's say a child is part of that at risk and the family's homeless. Yes, you're concerned about the child's development. You're concerned that, his cognitive development or his language development might be behind. But more importantly, if a family's homeless, you need to help them find a home so that that child can develop with a nice, stable environment. So sometimes your job doesn't look like just working with a child, okay? Which Cheyenne probably could share with you a little bit from her experience so far as a practicum student. The services are delivered wherever the child typically is. So sometimes, that's why I asked at the beginning who knew about this, because sometimes you'll see early supports and services providers in and out of child care centers. Because as we know, sometimes children spend the bulk of their time with us in child care. So Monday through Friday, if a child is in a toddler classroom from 7 a.m. till 5:30 p.m., they're going to get their services at the child care center. Has anyone seen that before? No? Okay. That's good. That's good or bad. It could be either way. It could be there's some children in your care that might need some services, or it could be you just haven't encountered this yet, and that's okay. But it's pretty typical for a provider who has a caseload of children to have at least 3 or 4 children who are in child care and seeing children in child care. And that's important because that's where the child typically is every day. So you want to go to where that child is and help support him or her in that environment so that they can learn in that environment. And then the overarching goal is that these things that you're working on are going to be carried over in that environment. So hopefully you're touching base with their teacher and writing a note for their parent so that the things you've worked on can also be worked on in the child care environment, can be worked on later in the home. And then you always are still working with the family. So even if you're not seeing a family, so when I used to see children in child care, I had a couple of different things I would do. Sometimes the mom or the dad would come and meet me at my appointment at the child care. Those were really usually very involved parents. They would take their lunch break and I would try to work around that. and they would come and meet me for this hour session once a week. Sometimes I would see the child in child care 3 times a month, and then 1 time per month I would try to come to the family's house, whether that was 7 a.m. in the morning or 5:30 p.m. at night when they were home. Or they would bring the child in a little later to child care if they could, just so I made sure to actually make contact with the family. Because sometimes you feel really disconnected if you're never seeing or talking to the family. The talking to the teacher is also really important so that the teacher knows what to do with the child as well. And then this only goes until the child turns 3 years old. So really the day before that child turns 3, services are done. At that 3rd birthday, you have to decide, you've decided before then, I write it there, at 27 months, you start the process called transition. Regardless of the child, if the child's doing really well in your care, you still come up with a transition plan because it's still a transition at that 3rd birthday that they're no longer going to be getting services. So sometimes I had children who were starting to transition around 27 months. They've probably almost caught up in their development in whatever area they were needing the support in. And the family said, I don't want to pursue any more special education services. I want to send them to a preschool at this point and decide whether or not they need services when they go to kindergarten. And that's okay. So I would make that transition plan with that family. I would help them find a preschool that maybe felt good to them, maybe even go on a tour with them. So like you really are supporting families in that next step. Sometimes families said, I want to pursue special education, so at that point, you start to make contact with the school district, because at 3, schools offer preschool services. So that's where they would do that process, and it's a whole different process. Do you have a question, Tristan? Okay.
So not every IFSP is going to transition to an IEP?
Absolutely not. Nope. And IFSPs and IEPs are looking for different things. So sometimes me as the home visitor would think if this child needs preschool services, they'll be evaluated at the preschool and the preschool will say, no, not eligible for us. So I'd have to come up with a different transition plan for that family. Sometimes it would be looking at their insurance and seeing if they can get any outside private services. So somebody like your Professor Kim is an OT, she can see children and bill insurance for that. So if she has a private setting to do that, I could direct them to somebody like that, or a speech pathologist who has an office that does speech services. Does that make sense? Yeah. And sometimes it's uncomfortable. So families maybe really hope their child's going to get more services and the school district says no, and that happens. Or sometimes they do get services at the school and the family's now freaked out because their 3-year-old's going on a bus and going to an elementary school. That's not what they expected at 3 years old. So there's a lot of emotions that go into this, and I like to always talk about the family's perspective, because we know development, we're working with the children, we're working with the families, we have this really great bond, but this is a short amount of time to go through so many different things for the child and the family. So you always come up with a plan, and you always are done services at 3. And I'll tell you, more times than not, the families will say, but you'll still come, right? You'll still be able to come and visit. It's really hard to be like, actually, no, when that child turns 3, a new child enters my caseload, and I actually don't have time to come back. But it's hard because they're expecting it, especially if the child started with you as an infant, a few months old, and you've kept them on your caseload till 3. That's a long time. That's maybe weekly visits with the same family. So it's tough. And then working in ESS, who actually does this? I kind of mentioned this a little bit, but SLP is a speech-language pathologist, occupational therapist. Those are really common in New Hampshire for people on teams, on ESS teams. Physical therapist is a little less common. Physical therapists now have to have doctorates to practice. So unless you became a physical therapist maybe 15 years ago, and are kind of grandfathered in without the doctorate, now going forward, if you guys wanted to pursue working with young children in a physical therapy situation, you'd have to get your doctorate. So it's many more years of school. Early childhood educator or special educator, you can get this. You can work in this field with a bachelor's degree if you get a certain certification, with a master's degree without the certification. And then you need a teaching certification. And you can get that at the bachelor's level or the master's level. And then a social worker sometimes, or a nurse. Anything else that you can think of that fits in those fields? Other states, Boston and Massachusetts, they have a lot of people with different backgrounds. These are just more common in New Hampshire. Mental health workers, sometimes too, who are not necessarily social workers, but they're in the mental health field. And then what does it actually look like? So it's basically play. And what I liked about it, what really drew me to it, and I kind of preface this conversation with people who don't want to be in a classroom, was that it was one-on-one. So I liked that. I liked that it was kind of a little bit more in a more controlled setting in that way, because it was maybe just one child, or if I liked twins. So I often had twins on my caseload because they were really fun and exciting. So in the home with the parents. So it wasn't classroom management. It wasn't thinking about curriculum in that way. It was really specific to each child and what that child needed. So that part really attracted me to this. And then the thing that maybe you want to really, if this is a field you're interested in, think more about are really doing some parent training and helping parents with helping their children during routines. So we know that sometimes it can be hard. Children with routines can be hard. So you're really helping parents through diapering, through bath time, through feeding time, through getting their child in and out of the car seat, because that can be really hard, and helping them not to be frustrated and giving them lots of tips and strategies for those things that are everyday activities that they're going to have to do with their child that can be that much harder when a child has a disability or a delay. Okay? So you're really, really doing some parent training here. So you want to actually be confident with that, because sometimes if you're young and don't have children, that can be hard. But you know your stuff. It's the stuff you're learning in these classes because you're going off of child development and the things you know about child development. And then you're doing a lot of things that look like just playing, but you're using really appropriate materials. So some of the things that are kind of behind Shauna, maybe shape sorters and ring stacks and cognitive things, puzzles, open-ended materials, things that we know as early childhood educators are the appropriate materials for kids. And then you're modeling that kind of play with parents, how to play with children with those open-ended materials. Most of the time, you're not bringing toys in at all. You're using whatever's in their environment because that's what they're exposed to. Or if you brought in a toy like a ring stack, because let's say it's the family that's homeless and doesn't have toys, you may bring them something that they can have for a few weeks, at least, for the child to play with. And during that, you're doing things like language stimulation. You're modeling language in a way that you know a child can learn language, kind of. You're using your words slowly and exaggeratively so that children are learning language that families might not know about. You're doing motor tasks or stretches or things that you're helping children with their muscles, their big muscles, their small muscles. Families aren't trained in that most of the time. And then you get to travel. So I use that as a selling point. It might not be, but you are in your car a lot throughout the day, so, right? So you start at one place and you're going to another place and you're going back to the office and you're going back out. So if you're a person that likes to be busy and not necessarily in a cubicle or stuck in an office, then this might be something for you. You put a lot of miles in your car, a lot of miles. And then you get to talk and listen and learn about families, which is really cool because everybody has a different lifestyle, everyone has a different family culture, and you get to learn a lot about families doing this in a non-judgmental way. Sometimes you're going to see or hear things that maybe shock you, but then you work with that family, you work with that family, you work with that family, and some of those things will probably shock you less once you hear more about their history, and you'll help them make better decisions, at least when it comes to parenting or paying bills and things like that. Those are things sometimes that you're helping families do. I'll stop there for a second and then talk more specifically about New Hampshire. Does anyone think this sounds fun? Yeah, kind of nods, yeah. A few students have left this program and gone into this field. Now, I've taught here 8 years, and so I have a few students, especially this year, now that I place students in these practicum sites every year. And I think this year I have 4 or 5 practicum students placed with students who graduated from this program. So they've gone and gotten bachelor's degrees or master's degrees and are doing home visiting in some capacity. So that's pretty cool. So they've people that are out in the field doing this work at different agencies. Let's see. So ESS in New Hampshire. I like to show you this. I don't know how well you can see the map, but you know what New Hampshire looks like. Is anyone here from the North Country? Okay. So in the North Country, I'm going to walk to the map here. If you're an ESS home visitor provider, you could be a home visitor down here in this corner, or all the way up here in this corner, because the North Country has a huge catchment area. So when you work in ESS, you work in one of these regions, and each of these regions has a catchment area. So when I worked in ESS, I was in Region 7, which was Manchester, Auburn, Bedford. It's one of the it is the smallest area, but it's the most populated area. So there weren't as many towns, but there were a lot of people, and there was a high need because of the amount of people. So there are different areas. Region 4 is where we are right now in Concord, so it's pretty good size. And there's a list, so I have links in here that show you which town is in which region. Tristan, do you have a question?
Yeah, so like these regions are, I think, I'm guessing, is like based on like population size and like the amount of like, because that's why the North region is so large, because the North is so sparsely populated.
That's true, yes. So there are, I actually don't know, I'm guessing you're right, that I don't actually have that information. So I think it all depends on the need in the state, and because this is federal money, our taxes pay for this and our federal dollars pay for this. So somewhere, some people at a table decided what the areas would be, and these are the regions that New Hampshire is broken into, these 10 regions. And it probably is on population, it's probably on different towns, but I don't, and then the money is allocated and dispersed accordingly, according to need. So every year they'll do, reports and decide whether or not they need more money in a certain region. Does that make sense? But as far as I know, and they've never changed this. This has been the way it's been. What I will say is North Country needs home visitors. They actually take people who have less, they don't need necessarily a bachelor's degree if they have experience in this, because they are needing home visitors. And usually they'll have somebody in a certain pocket of the North Country that just does that area, because you can't feasibly do that bottom corner and then in the same day go to the top corner. So, and a lot of times those families are so isolated from, popular communities or communities with a lot of populated communities, they might not even know these services exist. So getting people out in those areas to help those families is necessary sometimes. Has anyone heard of any of these agencies? Lakes Region Community Services, Moore Center, have you seen these or driven by these community bridges? So these are the area agencies. This is where people receive services if they have disabilities. And that's people through a lifetime, infants through elderly. And then this is the end. These are some links. I will send this to Shauna. She can post it in Canvas for you if you want to kind of click these links. I also will send her the link to this document. This is what families get. I'll show you the cover. When they enter the program, probably at that intake now, but I think we bring it out when we do our first visit as well. And it really sums up, just kind of in writing, all the things I just explained to you.
I think you turned off the things there.
Oh, I did, you're right. So the cover just says Family-Centered Early Supports and Services, a guide for families, and it just goes through that whole process, everything I just described. There it is. So it's kind of zoomed in a little bit. Questions? Who's in the disabilities degree? Sorry, I just cut you off. But who's in the disabilities degree? Anybody in early care and education for young children with disabilities? So Cheyenne is, because I know she's in practicum now. And you are? Yes. So you will do a home visiting practicum. Great. Okay, Tristan?
How hard is that, like, for someone that's in an ECD program, like knowing what, kind of having a base idea of what they want to do, but then getting interested in that? How hard is that transition to go from maybe I want to be a teacher to maybe I want to do home visiting?
And no Cheyenne? So Cheyenne works in childcare, but is currently doing a practicum in home visiting. Is it a hard?
It's definitely different. Your opinion is your opinion, and you are not allowed to say your opinion when you are home visiting.
Yeah, so not bringing in bias or judgment into home visiting, that part can be hard. And the reason for that is, think about a classroom. Let's say you're a lead teacher in a toddler classroom. You have the ability to really control that environment. You can control the routine, you can control the environment, meaning the toys, the setup, you can control the behaviors in it with those things. in the home, you can't do that. So it's about relationship building. You're building a relationship with a family, even if you see some shocking things. Cheyenne has already seen shocking things, our first class. And you're kind of deciding how you're going to proceed while working with the family from a strengths-based perspective. Does that make sense? It's not a hard switch to do early childhood and do home visiting. It's a really nice marriage, but it takes experience and it takes somebody who wants to do that, but you have to, like she said, you have to kind of let go of your biases. And that part is probably one of the most challenging parts because everyone is raised differently. Yes, Shauna?
I also wanted to add, too, that from an advisor's perspective, if you're thinking about where you're at in this degree and you're thinking about switching to the EYCD program, it's not that much different. So we intentionally, the only two people that raised their hand for being an EYCD wasn't surprising to me because we adjusted the order in which the 2 degrees take this class. ECE students are taking this class in their second semester of their first year, if you're following the traditional fall start path. And EYCD students are taking this in their second semester of their second year. So they're doing it at the same time they're doing their early intervention practicum. So we did that kind of on purpose. And the other thing that we like about it is that this presentation that Sarah gives really can sometimes trigger students to be like, you know what? I do want to do that. And then you can talk to your advisor and say, so how could I make that change in terms of the coursework that you're taking and be more prepared for a practicum in that degree instead?
And there's options. So when you do this practicum, it could just be you want to try this, you're interested, you're at an associate's level. So you can do a practicum in home visiting, leave this program with an EYC degree, and go and work in a preschool. That's fine. You're going to be eligible to do that, a preschool classroom. So you have options at this stage to kind of practice things, see where you fit, see what you like in the field, and then go forward in a degree in that specialization, if that's what you want to do. The other thing you can do is dual major. So a lot of students will do the EC program, stay 1 more year and do the EYCD program or the home visiting practicum if it's something they want to try. So there's so many options, and you guys are at a good stage to be able to kind of make those decisions if you're not feeling like I have to rush through. There are options. That's kind of it for my presentation part of this, but I didn't put it on there, but I can. It's easy to find, but you can always contact me if you want to pick my brain more about this. I'm happy to talk to students about this pathway to let you know what would be a good place to go. I will say, if you want to do this in New Hampshire and you want to do it at the bachelor's level, you have to get a teaching certification. So go forward and get your teaching certification at the bachelor's level, and then you'll be eligible and most likely hired in home visiting. They are looking for home visitors. So getting a job in this is not super hard, but the pathway there can be challenging because you have to get that teaching certification. Great. Thank you. Thank you so much.